Hi, I'm Marty McCafferty. I'm one of the medics here at Dan. You may have already heard my voice on the information line, or hopefully not on the emergency line. So I'm one of the voices that talks to divers quite often. One of the things that we get asked about the most at Dan is divers preparing an emergency plan. And it seems pretty simple at first glance, but there's some details that need to go into this that'll make it even better. And that's what we're going to talk about today, is how good is your plan and what exactly can you do to make it even better. The emergency plan itself, you have to realize what it's intended for, what's its purpose. And it's to allow you to have things in place, a whole process as to what's happened if you have an emergency, who's going to handle it, how to handle it, and most importantly, when to implement it. What are the things, the circumstance that would prompt you to put that into play? There also is very specific local knowledge that you need to include, such as environmental things that are unique, and certainly local resources, because depending on where your dive site is, there may be ones close at hand, there may be some that are a long distance away. So those kind of elements need to be included too. Also, what kind of first aid kit do you have? What's in it? Do you have O2 or other equipment? All those things can get put into your emergency plan to help maximize its benefit. Also, the people that are going to be likely to be with you, whether it's your staff or whether it's your friends that you dive with, what kind of training do they have, and how much skills can they bring with them? And the most important thing is, no matter what your level of training and what your experience is, the more you practice these things, the better you're going to be when the need actually arises. So remember to have practice. An important aspect of managing an emergency is, what do you do on the scene? Who's doing what, how are they going to do it, and how do you go about managing it? And we especially want to understand what Dan's role is in all this, what exactly we can do in these situations. Here's this couple of scenarios I want you to look at. The first one, we have a 53-year-old male who is kind of an inexperienced diver, did a couple of dives, definitely more recreational than anything else. They're not horribly provocative, but they're not benign either. After the dive, he felt that he was anxious, and this is what he told his fellow divers. He was feeling anxious. He also seemed to be breathing a little faster than normal. He reported that he did a rapid ascent. Rapid ascents, of course, are getting a little harder to define because now they've slowed the ascent rate to 30 feet per minute, so coming up faster than that seems to trigger the computers more easily. And that's another factor, as he was saying, his computer was beeping. So the only thing so far is that he feels anxious and he's breathing a little faster than normal. So is this particular case right now an emergency? Yes or no? What do you think? Probably not at this stage of the game is this an emergency. This is someone who came up faster than his computer thought was feasible, but he's got no other symptoms other than being a little anxious and breathing a little fast. That can be dealt with easily. This probably isn't one that you want to start calling 911 for. Another one we want you to look at. This is a woman, 45 years old. This is a resort course. Never been diving before, unfamiliar to the whole thing. During the dive, she reports that she's having chest pain, and after she comes out of the water, she's feeling short of breath. And the dives are really benign. They were shallow, they were short, nothing really significant about it. And the symptoms began while she was at depth. Now that's significant because if it was any kind of decompression injury or pulmonary barotrauma, you'd expect that to occur after she surfaced. This started while she was at depth. She's worried that she has decompression sickness, which, as you can tell from the profiles, is extremely unlikely. She is, however, coughing. So we've got chest pain, shortness of breath, and a persistent cough, and a non-productive cough. Does this constitute an emergency? What do you think? The answer in this case is yes, because we can't rule out the fact that this may be a cardiac issue, or it may be a pulmonary issue. But either way, symptoms like that, you've got to act quickly and assume that it's something serious until proven otherwise. We know we can take decompression sickness out of the list of suspects, but definitely this is one that would prompt that emergency action plan. Remember, emergencies can be very subjective. What appears to be an emergency to one person may not be. I know the years I spent in emergency medicine, we would look at a particular case and from all objective criteria, no, it's probably not an emergency, but certainly to the people involved it is, and you have to remember that. Even though it may not constitute, in your experience, an emergency, to the people that are involved in it, it certainly can be. So don't dismiss how they're feeling. Of course, it's hard too because they expect you to be all excited and acting quickly the way they are, but you have to remain calm and not get caught up in their emotion. A thing that's important to discuss ahead of time is what conditions, like the two cases that we just discussed, what is it that's going to prompt the activation of that emergency action plan? When do you want to implement it? And it's good to have a game plan ahead of time because there are some things that should, no question, prompt you to start that plan right away. Your emergency action plan is only as good as the information that's in it. How comprehensive do you want it to be? Obviously, you can't make it too terribly broad because then it's going to create more of a problem and kind of collapse on itself. So you want to be practical in its scope in terms of how much you can deal with. You have to keep the information current because things do change. From year to year, doctors can move, clinics can close, all those things. So you want to keep it as current as possible. You have to accommodate too what your available equipment is. And you want to make sure that whatever equipment you have, you've got personnel that are able to handle it. What care can they provide, and do they know this equipment and how to use it properly? So that's all part of that action plan. It should also include provisions for, of course, dive injuries, which hopefully don't happen, but you also want to include information on non-diving injuries. It's just as easy for somebody to trip in a quarry over a rock and end up hurting a leg or an arm. So you want to have some preparation for that. And it's always worth having some kind of contingency plan for what to do if you have a missing diver. Most of the quarries or the other dive sites do, but it's nice with your group to have those kind of things in mind. At least have some kind of plan ahead of time. What are your local resources, especially in an emergency? What resources do you have in your area? Local EMS certainly is always available. Local law enforcement if necessary, and they can help implement a lot of these things too. If you're off the coast, certainly on the Great Lakes or certainly on the ocean, the Coast Guard can be an option. It depends on what's going on. Even some cases, U.S. Navy can get involved, but that's extremely rare. But are they available? How do you contact them? That's the biggest thing, is what's the best way to access these resources, and when is it appropriate to contact each of them? You want to talk about these things. And the agencies involved, they're very willing to talk to people and let you know when they think it's appropriate to contact them. So keep that in mind. As far as the medical resources go, obvious the primary one, EMS, fire rescue. Get them on the scene right away. They've got equipment, oxygen, medications. They bring it with them. So that's always a primary. Don't discount your local emergency rooms either. Even if they can't treat a diving injury with hyperbarics, there's a lot of things they can do to get treatment started and maintain this patient's stability until they can be transferred. And if it's something minor like ear barotrauma, something that doesn't need hyperbarics, certainly an urgent care works just fine. The doctors there will know how to treat minor injuries. Ultimately, if it is a dive injury, you want to get them to a hyperbaric chamber, but that comes down the line. It's most important to initialize medical treatment first and then give Dan a call, and we can work with the facilities to determine, do they need to go to a chamber, and if so, where? That's what our role in this is. And please don't focus on the hyperbaric chamber because they may not need it. That comes down the line and you have more time than you think. But certainly it's worth knowing whether it's 30 minutes away or whether it's 4 hours away. All right? In your local area, there are certainly unique conditions that you have to know about as far as currents. Are there regular currents? Are there riptides at that point? Or is it prone to heavy surf or surge? These are all things we know anyways. Is there a lot of boat traffic in the area that you're going to be diving? Is that going to be a hazard that you have to worry about? Certainly, if there's a lot of fishing going on in a particular area, you can always end up getting caught up in fishing line or some other entrapment. Remember too, if it's a wreck dive, is there particular aspects of a wreck or rocks in the area that might be a concern? So know your area and anticipate the problems you may have. Also, any particular marine animals that are of any concern. There could be none, there could be several of them. But know these things too. And what environmental factors can change quickly. I'm sure most of you know that there's dive sites that you can only safely dive during slack tide. But that's good to know. And also too, certain times of the day are better to dive than others. So all these things can be built in so you can anticipate what you're going to need. And among your divers, do you have that culture of safety? Is this a group that tries to focus on safety and always works to that aim? What are hazardous marine life? I know we talked about that. What are local species? You know, in a lot of the textbooks you start hearing about the blue-ringed octopus and the yellow-banded sea snake. Well, I know where I grew up, we didn't have any of those things, certainly not in the Great Lakes. So what are the hazards that are local to you? Do you have sea urchins to worry about? Are there crown of thorns? You know, are there anything that's going to likely to bite you, even freshwater fish? If there's jellyfish in your area, what species are they? And are the populations seasonal? Some are. There are certain times of year where you may see more jellyfish than you normally would. So if you know these things, then you can anticipate the kind of injuries you might have. Also, it's a good idea to know whether or not the fish that you catch may be poisonous to eat. Some areas seem to have a higher number of ciguatera cases than others. And it's nice to know ahead of time if you live in one of those areas. Most of the United States, the numbers are very low. But especially if you're traveling, that's a good thing to know. A very important basic part of any emergency action plan is having a good first aid kit, knowing what's in it. And are the items that you have appropriate for the area that you're going to be in? And do you have enough for the size of group that you have? If it's only big enough to treat 2 or 3 people, you may need to get another one or a larger one. Because if you're leading a group of 10 divers, obviously you need more supplies. So keep that in mind. Another aspect that you have to remember when it comes to your first aid is how far are you from medical help? Are you an hour away? Is EMS likely to get to you in 15 minutes or so? Or is it going to be substantially longer? Obviously, the farther you are from medical help, the more supplies and the different supplies you're going to need. Your personnel, the people that might be administering aid, what's their training? Are they familiar with being in remote locations? Do they understand how to use everything you've got? So those are key issues to remember. And above all, please maintain that first aid kit. Those supplies in there do expire, especially the medications or the solutions we use for irrigation. Those things expire, and it's a good idea to go through it, see if anything's been damaged. When we dive, we're always in a wet environment, and not everything holds up well to moisture. Simple bandages, all those things. Make sure they're clean, dry, and if any question, replace them. And it also, when you go through your first aid kit, it's a great time to re-familiarize yourself with what's in it. There's been many times people have been surprised, oh geez, I didn't know we had that. So it's a good idea to go through it and get a schedule down. About oxygen. Do you have it with you? And what is your plan or your policy for when to start administering oxygen? It's something to think about ahead of time. As part of that, when you implement the emergency action plan, also include in that, when do you start the oxygen for somebody that may be injured? And once you start, what's your plan or policy for continuing that? Do you want to keep them on it for so long and only so long, or do you need to keep them on it until EMS arrives or you get somewhere else? So it's something to think about ahead of time. We're often asked by dive group leaders, certainly dive operators, how much oxygen should they have? Well, the best answer to that is how remote are you from help? You have to think about it. What's the greatest distance or the greatest amount of time that you're likely to be away from shore or the dock where somebody could be there to help? So you should have enough oxygen to at least get you back to the dock. Also, how many potential divers are there in the group? Are you only going to be having 2 or 3 with you, or are you going to have 24? That can influence how much oxygen, because it's entirely possible that you may have more than one injured diver. So try to factor all these things in when you're deciding how much oxygen to have. That's going to be crucial for you. Other supplies, there's many things that you could have that would be appropriate. Certainly an automated external defibrillator, especially if you're remote from shore, that's a good idea. It's a big investment, but it's worthwhile. So you may want to consider thinking about getting one of those. Also, remember, Dan has an AED grant program where we can match the funds that you raise, so that's something you can take advantage of. Also, Dan has an oxygen grant program. For your dive club or potentially dive shop, you may qualify for a Dan O2 unit, so that's something else you can keep in mind. Medications should be limited strictly, of course, to over-the-counter medications, but you can carry an array of different medicines. But again, think about what you most likely would need and have that along. Communication devices, how are you going to reach? If you need help, how are you going to reach them? And is there any mandatory safety equipment? I know the boats quite often will use a tagline off the stern, and on boat dives, it's a good idea for all of us to carry that surface signaling device. Is that something that you can provide either through a rental or let divers borrow, or do they need to bring that with them? Is that something they provide? So, good idea to think about it and let people know ahead of time if they need it. Best thing you can do with any of your gear, it's just like your scuba equipment, preventative maintenance. Remember, your oxygen regulators need regular servicing just like your scuba regulator does. The oxygen cylinders need to be inspected as well. So it's worth to set up that kind of a schedule. Your first aid kits, number one, you want to look at the container itself. Then work on those contents like we talked about. Make sure you go through it, make sure nothing's expired, everything's up to date, everything's still usable, clean and dry, all that stuff. Make sure your O2 equipment works and that it's got enough oxygen in it. We've had more than a few dive shops or operators get horribly surprised when they found out they had less than 500 psi in their O2 tank and didn't know it. So make sure you know it's well maintained, and your communication equipment, make sure it's functioning. Does the radio work? Do you get a cell phone? Do you get a signal? How often should you inspect the equipment? That's up to the operation and you as an individual to figure out. Do you check it daily, weekly, monthly, or is it one of those things you can check annually? It doesn't really matter so long as you have a plan and can kind of stick to it. Whatever you can live with and whatever is appropriate for your situation. Your communications, one of the things, if you're on a boat, you're going to need that marine band radio, because you're going to reach the Coast Guard on channel 16 if you need them. So it's good to make sure the radio works. As an alternate, I know they're expensive, but if you're going to be in a remote area, you might want to consider a satellite phone. That's a good, reliable way to reach from long distances. Cell phones, everybody's got one these days, but make sure that you can get a cell signal when you're away from there. Even some local quarries, they're a long enough distance from a cell tower, you may not be able to use your cell phone. You might get a surprise and notice there's no bars on your cell phone. So now you got to know where the closest landline is in order to call. And we talk about communications not just with potential rescuers coming to your aid or additional resources. Make sure you've got a good system of communication among the staff. Who are the providers there and who are the rescuers? And make sure you all talk to each other and have that game plan ready ahead of time. Why do we want you to call 911? People are surprised when we at Dan will say, don't forget you want to call 911 first thing. The reason why is, as much as we would like to, Dan does not have an intimate knowledge of all areas. We get a lot of calls from certain areas, so we're somewhat familiar with it. But there's many areas that we don't have an intimate knowledge. We don't have the information that knows every resource available or exactly where you are. But we can figure it out quickly. It's important to remember, too, that not all symptoms after diving are necessarily dive injuries. Don't forget, somebody that's diving can just as easily have a heart attack after diving, have a stroke, fall and break an arm. As silly as it sounds, not everything is necessarily a dive injury. And what's also just as important to remember is that not all dive injuries automatically get treated in a hyperbaric chamber. If somebody's got bad ear barotrauma or pulmonary barotrauma, that's not something that gets treated in the chamber. But it's still important to get them to medical care and to get a doctor to make that diagnosis. Local EMS, when they show up on the scene, they've got access to all kinds of resources. They can call in the cavalry if they need it. And remember, if you're in a remote location where a hospital is some distance away by ground, they've got a patient who's serious enough, they can call for a helicopter, and the helicopter can come to the scene. They also, because of their skill and knowledge, they can help rule out other causes too. Like I mentioned, people can have a heart attack. So you get somebody with my color hair that surfaces from a dive and they have left shoulder pain. How sure are we that that's not a heart attack as opposed to decompression sickness? They have the equipment to help find out, is it a heart attack or is it something else? They also have a much larger supply of O2. They can start IVs to keep divers hydrated, and they can monitor their condition to see if they get better or worse. It's much safer to have somebody transported in an ambulance with the crew that can monitor them and take care of them than running the risk of driving them in a private car and suddenly they get very sick on you. That's frightening, and that's a position I hope none of you ever find yourself in. So please, along with calling Dan, make sure you call 911 and have that as part of your plan. Yes, we can help in these situations, and I can tell you what our role is in this. We can help you decide. The word triage you see used, that means to decide who's most seriously injured. That's one of the things we do. Is this somebody that needs to be seen immediately? Is this someone that you have more time that you can maybe drive them yourself? It's going to depend on the severity and what's going on. We can consult with the people on the scene to get an idea of what needs to be done for this patient in the meantime and whether you really do need to call 911. We also have a network of referrals to local physicians, and if you're DAN members in your remote location, certainly outside of the United States, we can arrange a medical evacuation if the care isn't available locally. Also, the DAN insurance comes in very handy, especially if you're outside of the U.S. The things to keep in mind is that we cannot, over the phone, not a doctor, and certainly not us in the medical department, we can't diagnose over the phone. We can talk about the things that seem most likely, but we can't make a diagnosis because we can't examine the patient, we can't see them, and that would not be ethical. Also, we don't know what's available in terms of local transportation. Sometimes, especially if you're in foreign countries, sometimes it's easier and quicker to get them there by cab than it is to wait for an ambulance. So depending on where you are, you may have to rely on something else. But certainly, we can't know for sure that. You're in a better position locally than we are. But we're there to help, and we're there to give as much advice as we can. As much as we would like to, and we keep asking the board of directors for it, we don't have our own fleet of aircraft. We wish we did. And I would volunteer for the flight crew without a problem. We don't have an emergency response team. We quite often get called from public safety departments that say, hey, we need your dive team. Unfortunately, we don't have that capability. Again, wish we did, but we don't. The local folks have got the better resources. We don't have them to send. We can't provide an actual scene rescue or extraction. There are plenty of people that have these services available through the Sheriff's Department, Coast Guard, depending on the situation. They're the ones to call because they can do that. We unfortunately cannot do that. We can if you're at a hospital and you need to be moved, and again, this is mostly outside the United States. If you need to be moved to a facility that has a greater level of care or more appropriate care, and you're a DAN member, that's where we can come in. We regularly at DAN, we spend as much time talking to divers, we also talk to EMS crews, and we certainly spend a great deal of time consulting with doctors in the emergency rooms. They need a little guidance, so that's what we're there for, helping them make a diagnosis and ultimately decide on what treatment to give. That's what we can do and quite often do. There's always some concern about legal issues, certainly the medical legal issues. If you remember, the number one priority is to do no harm. As long as you're not doing anything that's going to further injure this person, you're going to be okay. You have to make sure that you stick within your level of training. As long as you stick to the level of training that you have, you're not going to get yourself into trouble. It's consistently when people try to do more than what they're trained for that problems arise. This is too, it emphasizes the importance for having that emergency plan or a process in place. If you already know ahead of time, have a good idea of what you're going to do, and you stick to that, that's going to help protect everybody. You want to have an idea of what the Good Samaritan laws are in the area where you're likely to be diving. It's not unusual for people to live in one state and dive in another. So it's important to know what the Good Samaritan laws are wherever you're going to be diving. Most of the time they're there to protect everybody, but there's little differences from one state to another. So it's not a bad idea to be familiar with it. But again, if you do those first things, which is do no harm, stick to your level of training, have a process in place, you're probably going to be just fine. Another thing that helps protect everybody, including the people you're taking care of, is to have some kind of reporting or documentation policy. Among EMS and emergency medicine, the kind of unwritten rule is that if it isn't written down, it didn't happen. So this protects everybody. If you write things down and document, it's a wonderful thing. That way you've got information in writing that you can pass on to the next level of care. There are some forms that are already made that are available commercially, which is fine. You should have them on your boat or in the dive shop or have it with you in your dive bag. And it's worth practicing that documentation. Have an idea of what you want to find in that. Most of them, yes, have kind of a fill in the blanks, but it's worth doing that. Practicing it, the more comfortable you get to it, the less likely you are to overlook something. And among your crew, whether it be it your staff or the friends you dive with, you want to make sure that you define terms. What exactly do you mean, and what's the difference between an incident or an accident? When do those terms apply? There's no real right or wrong to that, but it's as long as you all have a common understanding of what those terms mean. That's what's most important. You want to stay away from the more ambiguous terms, and there's also some judgment to those terms. So you want to avoid things like near miss or close call, anything like that, because that's ambiguous and too there's some judgment involved there, and you don't want to make any judgment. You want to be as objective as possible. You want to make sure that everybody that's going to be diving with you, be it your staff or your friends, they're familiar with that emergency action plan. And there should be some sort of mandatory familiarization with it, if not training. And whatever plan you have, make sure it's easily accessible to everybody so they can see it, they can read it. You should have it written down and let everybody read it so they know what information is on it and what you have in mind. You also want to practice. This is something that gets overlooked. All the skills in the world are great to have, but it's worth practicing them. Have safety drills. What are things that can be done to prevent some of these things? And certainly what to do in a situation where something really does go wrong. How do you handle it? And the training of the folks that you have that are going to be with you, that's important. Very much do we encourage continuing education. The more you know, the better you are to cope with these things and the better care you can provide. Will we like you all to take DAN courses? Of course, absolutely. But there are other resources that provide very good education. The most important thing is get the continuing education and make sure you've got current training. For practice, you can stage the drills and scenarios and make sure they're ones that will engage everybody emotionally. Make it fun, make it engaging so that they want to do this. Makeup and props can certainly make it seem more real. It can enhance the whole thing, and that's important. And keep your scenarios realistic. If you're diving in a local quarry, it's unlikely anybody's going to get chomped on by a great white shark, so you're not likely to deal with that type of injury. Keep it relevant to what is likely to happen where you are. And encourage your patients. Get people to volunteer. A lot of kids from the local high school, they're in the drama club. They're great for that. We used to recruit them, and they're great, and they enjoy it. So keep that in mind. Any of your family members who are non-divers, you can recruit them. And encourage your rescuers to approach it as realistic as possible. I know it seems kind of odd, and people are a little, hesitant at first because you're play acting. Well, approach it the same way you would any patient. We do that when we're being trained in CPR or any of the courses. You have to practice patient care. So certainly, even in these scenarios, keep it realistic, keep it fun. Afterwards, debriefing is always an important element. Certainly, in a real-life emergency, people need to talk about it. Among even the professionals, those of us that were in emergency medicine for a living, they call it critical incident stress debriefing. These things affect people. When there's even something that doesn't end in a tragedy, it still is very emotional, and your rescuers get caught up in it. You can't help it. That's a very normal human response. Be sure and talk about it. Even after the simulations, you want to talk about it. It's also a good quality assurance tool. You get everybody involved in that process. They feel more invested in what they're doing. They're more of an active part of it, that they had a real role to play. They will be better supported emotionally. If they can talk about how they're feeling, what they felt, that's important. And when they really need that kind of emotional connection, they'll know it's available. In your local areas, there are professionals who are trained at how to specifically deal with that critical incident stress. Reach out to them. They're love to talk to your group. They want to educate people on it, and they want to be available when necessary. Again, these debriefing sessions, especially in training, it gives you that quality assurance, that quality improvement opportunity. What did we do right? What could be better? So these are wonderful tools to have, and absolutely worth every bit of time you would invest. When it comes to scene safety, number one rule is your safety comes first. Do not put yourself or others at risk, because then you end up with multiple victims. You don't want to make it worse. So if you aren't trained in dive rescue, please let the people that are trained do it. As simple as somebody being in a cave system. Think about it. You don't want to send open water divers in there. Even though it sounds like it'd be pretty simple, you need specialized training. So let the folks that have the appropriate training do it, and don't end up becoming another victim yourself. Personal protection equipment, that PPE, make sure you've got gloves in that first aid kit. If necessary, carry a splash shield over your face. You may run into bleeding sometime. Have something there. You can tell by looking at these pictures, these folks don't really weigh out, scene safety, as it were. And the poor little beaver that got caught there, I use that picture for two reasons. One, he didn't plan ahead of time, which you can't blame him, he's a beaver. But two, if you saw a beaver in that case and you wanted to help them, you have to be prepared. Because remember, injured animals don't know you're trying to help. So be prepared that they're not going to be all that cooperative. And again, you may want to have a pair of heavy gloves along. The scene management, this is something that takes a little bit of skill, but with pre-planning, it can work pretty well. That scene management is important because I've been on too many scenes where it's utter chaos. You have a whole lot of people that all want to do things, but they're kind of running around in circles and not quite having any true direction. Having an emergency action plan is the first step to that scene management. Who's going to do what? Have what you want these folks to do, have that assigned ahead of time. Who's going to call 911, or who's going to get on the radio and call the Coast Guard? Those things are important. Who's going to manage the folks on the boat? Keep in mind, you do have to kind of give the rescuers room to work with the patient. You want to keep some of the folks back away, give them time to work. Also, too, it comes down to those skills. Who's the most skilled person for this? You know, if you've got somebody who's got advanced life support training, that's probably not the person you want to have calling 911. Let them take care of the patient, have somebody else call. It is a team effort. The more organized you have, the more everybody knows what their task or role is ahead of time, the smoother it's going to go. If you know your folks well, what skills they bring to the table, like I said, the person with advanced life support training probably isn't the one you want making the phone calls. Have them work with the patient, have somebody else. Know when it's time to ask for additional resources, because you can always use more help. And believe me, it's better to call them too soon than to wait too late to call. So even if it doesn't seem like it's bad at the time, think about calling, because they would much rather show up and not be needed. And above all else, remember to protect the patient's dignity. Even if they made a terrible error, they don't need to hear criticism from anybody else. So keep your comments professional and appropriate. And if you have to get them into various stages of undress, at least have something you can cover them with. Try to protect their dignity as much as possible. Know how to communicate in an emergency. How do you talk to the patient? How do you talk to their family members? Because that can be a real skill involved there. There are folks, especially in the family, they're excited. This is someone they love and care about. And they sometimes get distressed because you don't seem to be taking it as seriously as they think you should. But you stay calm, stay professional, and it makes a huge difference. And as far as crowd control goes, it's a simple matter of just asking people to stay out of the way, step back. But don't just tell them to do that. Ask them and give them a reason why. It can be as simple as, "Sir, I need you to step back so I can take care of your friend." "Sir, step back so I can take care of your friend." It's known as persistent repetition, and it comes in very handy. And don't allow your emotions to escalate to the other people on the scene. It sometimes is a challenge, but you'll be grateful that it turned out that way. Also, how do you give a report to EMS, the police, or any other people that are going to be that additional care? Think about how you want to organize your data. Certainly, one of the things we hope we never have to do is talk to the press. And quite frankly, most of the time, no comment would be best. But think about that ahead of time. If you do want to talk to them, there's important information you need to give. Make sure you've got it organized before you do that. And one of the things that we do at Dan is we try to follow up with everybody we've had contact with. And that's important. And that really makes them feel that you do care. And two, you get to know that what you did make a difference for the person. If you find out that they were discharged from the hospital after a couple hours, that helps. You can let the folks that helped on the scene know what they did really did make a difference. And certainly knowing that outcome really makes a difference, and it really helps bring it all into perspective. So it's very important to be proactive from the very beginning. You want to create that safety culture, having people think about safety from the very beginning, because it'll help prevent a lot of these problems so you don't have to intervene later. Recognize and avoid and manage all the potential risks. There can be more than others at a time, but if you think about them ahead of time and anticipate what may go wrong, that'll make your emergency action plan more viable. Be prepared well in advance. Have the process in place. Practice, 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 and have the right equipment for the right situation. Be aware. Have all your divers and your staff be aware. And it's important to set the example of safety. Part of having that culture of safety is that we as divers be as safe and set an example. We want to be the ones that lead it. Encourage safety in others, and when you see people that are doing things right, are being safe, make sure you acknowledge that. Tell them what a great job and all that. It takes some preparation for this, takes time, but all of these things that you have ahead of time in that emergency action plan with the practice and all those things, it will make things run much easier and really overall will give you a much better outcome. Thank you for your time.